name of our presentation is sinusitis.
All right. What is sinusitis? This is the inflammation of the sinuses that occurs with a viral, bacterial, or fungal infection. This is usually due to allergies or infections. All right. Okay, sinuses, they're usually air-filled spaces in the skull that are lined with mucous membranes. A healthy sinus have no bacteria or other organisms and are open, allowing mucus to drain. However, when you have sinusitis, it is caused when the sinuses become inflamed and blocked with mucus. And over 30 million adults and children get sinusitis.
The different types of sinusitis are chronic sinusitis, acute sinusitis, recurrent acute sinusitis, subacute sinusitis, acute exacerbation of chronic sinusitis. We're going to talk about chronic sinusitis and acute sinusitis. Chronic sinusitis is basically the swelling of the air-filled spaces behind the forehead, cheeks, and eyes, which continues for a long time or can return. It's less common than acute sinusitis, which my partner will speak of soon, and it can damage the tissues of the sinuses. Usually, the picture. They're right here are the sinuses, right here from the forehead and around the nose are the sinuses. And basically with chronic sinusitis, the normal air, usually the air passes through them, but because it's blocked by the mucus, it causes an infection. Blockage in the nose from allergies. It's caused by nasal polyps, which are small sac-like growths made up of inflamed tissue lining, and it can affect your breathing, nasal obstruction, runny nose, and you may sound congested. There's dental infections.
All right. My part is acute sinusitis. This occurs when the air-filled cavities around the nose and nasal passages are inflamed with the accumulation of fluids that may interfere with the normal drainage of mucus in the sinuses. The symptoms of acute sinusitis are facial pain, fever, bad breath, sore throat, you may become nauseous, cough, dental pain, and nasal congestions. To prevent acute sinusitis, you may minimize the contact with people who have colds, avoid cigarette smoke and polluted air, use humidifiers, and limit the use of alcohol, because this can cause sinus passages to swell.
There are different ways of diagnosing sinusitis. One way is called percussion, which means that the physician taps lightly on your face over your sinuses to reveal tenderness. Then there's chance illumination. With normal sinuses, when the doctor lights up your nostrils, you usually see a glow, and the shine lets them know that you have clear sinuses. But if you have sinusitis, there will not be a glow. And then there's CT scan, MRI, and sinus x-rays, which are imaging tests, which show the sinuses to be filled with fluids or reveal thickening of sinus tissue. There are a number of treatments, and of course, the goals of all treatments is to cure the infection and make the symptoms go away. Some of the treatments are steroids, antibiotics. They're used if the sinusitis is caused by bacteria. Then there's osteopathic manipulative treatment, which is OMT, which is what we're mainly starting to study about, but we haven't really learned much since the beginning. But we know it involves something with the muscles of the sinuses or on your face. Prescription decongestion.
These are like pills taken by the mouth that help relieve stuffy nose.
Pain relievers. Then there's nasal corticosteroid sprays.
And these help relieve symptoms that are due to allergies.
There's oral corticosteroid spray and surgery, which they use to clean and drain your sinuses or repair the deviated symptom or nasal obstruction. Reoccurrence of sinusitis with treatment. So if you're treated for sinusitis, you can usually be cured, but it takes time for it to fully go away and not reoccur. Reoccurrence of sinusitis without treatment, since it wasn't treated properly, it will tend to come back and return. And if the conditions such as your nasal blockage are not treated, it has a higher rate of reoccurrence if not treated, and can become worse than before.
All right. In the future, we would like to see how effective OMT, which is osteopathic manipulative treatments, are. And we want to know why some of those who are treated for sinusitis continue to see symptoms.
Thank you.